continuing along with our previous thread about otoplasty and what things are possible and not possible, I think one of the things we haven't really broached yet is what are the potential complications, what things can you avoid or should they avoid before surgery and after surgery to have any of those complications as well?
Yeah, really there are complications that are common to any surgery. They're not common in terms of frequency, but things that can happen with any surgery. And those include infection, which I don't think we've ever seen an example of in otoplasty, and hematoma, where blood collects underneath the skin. And again, that's not something that we see. A lot of that has to do with care and precision in doing the procedure itself and making sure that there's not excessive bleeding during the surgery. And then the dressing plays a big role in that the first night of surgery, to put a little compression and pressure on the ears and make sure that there's not a lot of swelling or potential bruising in the first day. The other complications are really things that happen down the road.
Absolutely. So, in the immediate aftermath, right after surgery, the main things that we want to sort of keep an eye on and be aware of is if they've got excessive pain on one side more than the other, things of that nature where you would start thinking, hey, maybe there's a hematoma, maybe there's some sort of infection or something going on, in which case you want to talk to the surgeon relatively quickly and make sure, but that's really in the immediate first day post-recovery stuff. That doesn't usually happen right after. Beyond that, then it becomes more of a long-term issue. What happened during surgery that can lead to some of the long-term problems with the shape of the ear itself.
Yeah, and those things really have to do with healing over time, and the ear just didn't heal the way that was intended, that the surgeon or the patient wanted. One of the things that can happen is loss of correction, where the ears were initially pulled down tightly, but over time they actually, usually on one side, might come out more than the other and look asymmetric. A second thing that can happen is the ears just didn't assume the right shape in the first place. Maybe they bent it one way up at the top, but this part that's sticking out at the bottom didn't come back in properly. Or as the ear bent, there can be an unsightly ridge or deformity in the smooth contour of the ear cartilage itself that just looks unnatural, looks abnormal.
So a couple of other things that people talk about, and I'll just quickly mention with you, is sometimes the ear the shape itself isn't proper, where it's a telephone ear deformity. Other times the earlobe itself, everything else gets sit back, but the earlobe is still sticking out. So can you address some of those things as well?
Yeah, so those have a lot to do with under-correcting or over-correcting certain parts of the procedure. And that's why it's so important to see surgeons who really do this a lot. Otoplasty is not the most common procedure requested in any plastic surgeon's office. There are a lot of surgeons who really, frankly, just dabble in it. They might do one or two every 6 months or a year and not do very frequently. And like everything in life, if you don't do something very frequently, you very often are not masterful doing it, and you're more likely to get problems doing the procedure itself. So those issues you talked about, if one area is under-corrected, and often it's this conical part of the bowl of the ear itself is not brought back in properly, but the rest of the ear is folded over, the ear can still look like it's protruding in the middle and coming out. We call it a telephone ear deformity. You can get the opposite of that happening, where this part bent in too much, and yet the top is still coming out, and that can look equally unusual.
Okay. And as far as the earlobe itself, any particular tricks, secrets to that?
We often look at the earlobe and really treat it at the same time as doing otoplasty. There are a lot of surgeons who kind of look at it as an afterthought or as a separate procedure. And people who have prominent ears, often the earlobe itself is too big, it's excessive, it's pulling down, or it's sticking out. And so we'll bring the incision all the way down and actually often take out some skin or take out some fatty tissue from behind the ear and set the earlobe back itself in order to bring it in line with the correction.
Great, thanks a lot.